My name is Dr. Brian Van Brunt, and I'm the Director of Behavior and Threat Management at DPrep Safety. This is the third quick takes and threat assessment that I wanted to share with you, and it's another really important concept when we're conducting a threat assessment. This concept centers around a straightforward idea that there are psychological assessments, but there are also violence, risk, and threat assessments. Let me define all three for you. A psychological assessment, when someone's asked to complete this, is typically about determining is that person in need of a certain level of care, often a locked inpatient admission. And these can be either voluntary or required or mandated, depending on the state. Psychological assessments are often focused on is the person, do they have a diagnosis? Do they need medication? As I mentioned, do they need to be in the hospital? What kind of outpatient care? And what does their treatment program look like? The problem comes in when someone at a school or a college or a workplace says, we're concerned about this person, let's get them assessed. And what they end up doing is they defer to a psychological assessment rather than a violence risk or a threat assessment. A violence risk assessment, and this is helpful now that you have some of this terminology, is really concerned a lot more with the idea of is this a threat that is substantive and maybe built off of a strategic and mission-oriented plan of violence, rather than a threat that might be transient in nature with very little actionability or lethality, and one that's more effective and emotional in reaction. We don't typically see individuals in this emotional space, this reactive space, because of environmental stressors moving into a space of a mass casualty or school shooting event. Where we want to really make sure we're drawing this distinction, again, in threat assessments when we're assessing a particular threat, or a violence risk assessment where we're trying to understand what's the risk here of this person moving forward on a pathway to violence, how very different that is than what a psychologist, a master's level counselor, a social worker, an individual who's being asked by the school to do an assessment often. And that assessment often defers to a psychological one. So the miss here is that the school is concerned about a student or the college or the workplace, and they're asking for an assessment. The person doing the assessment is doing often a level of care to determine if the person of concern belongs in the hospital. And what we really want to focus on is if someone's making threats or there's a concern about a targeted or mission-oriented plan of violence or a more substantive attack plan, this is where we want to make sure we're not falling into the trap of just using a psychological assessment, but instead using this larger VRA or violent risk assessment. Now, certainly there can be folks within the psychology field, there are many of them actually, who do a really nice job of doing both. There are times where an individual might have some mental health or diagnostic issues that play into the overall risk of their dangerousness to carry out a school attack. The more concerning part that I see, though, on the national level is this miss, where we're sending someone for an assessment and the school, workplace, college, or university feels as if they've done their due diligence to get the person assessed, but they're getting them assessed for the wrong thing. They're having them assessed for a level of care to go in the hospital, not being assessed to determine are they on that pathway to violence, developing what we would call, again, this strategic, predatory, tactical, mission-oriented plan of violence that oftentimes can stretch and has been thought of for weeks, months, or years. Psychological assessments are often in the moment and concerned with immediate or imminent risk, which is a different kind of question. So as with any assessment, making sure that you clarify what we're assessing for prior to beginning that assessment becomes critical. Thanks for your time.